Good morning, everyone. Welcome on this very lovely, drizzly Thursday morning. My name is Dan. I'm a product manager here at Breathe, and today we're going to be talking all things health and safety risks in 2026. We've got a lot of exciting things to get through today, looking at sort of some key risks and gaps that you might have within your organization, and in order to stay compliant within health and safety. And then we'll go through some introductions, and then we'll start getting down into the nitty-gritty and having some really sort of insightful conversations. We are joined by Emma del Torto, Managing Director of Effective HRM, and Cy Hook, Head of Operations at Breathe. So Emma, would you like to introduce yourself, please?
Hello, everybody. My name's Emma. I'm based in South Wales. And as Dan said, I'm the Managing Director of Effective HRM. And Effective HRM is an outsourced human resource management and health and safety consultancy. And before I started this business, I was an employment lawyer. So I understand all too well the very close relationship between health and safety and employment law, and how important it is for all organisations, and especially SMEs, I think. So,
lovely. Thank you very much, Emma. And Cy, care to introduce yourself?
Thanks, Dan. Thanks, Emma. And thanks, everyone, for joining. So as Dan said, I'm Cy Hook, Head of Operations here at Breathe. I've been at Breathe now for a little under 7 years. In operations, as I'm sure many of you probably are aware on the call, you end up wearing many hats and juggling a lot of tasks. One of those tasks and responsibilities is health and safety, fire safety, health and safety, and you have to find time to prioritize and make it as important as anything else you're working on. So that's what this session today is all about. So really glad you're all here. I hope you have a great session, and we're looking forward to answering any of your questions that come in. So thank you.
Awesome. Thank you very much, Cy. So as we've kind of already touched on sort of why we're hosting this session, but just to kind of go through that in a bit more detail before we start going through some hidden risks that could crop up in your organization. So here at Breathe, we're talking to SMEs every day, whether it's being in the product team, the marketing team, operations. We're all talking to SMEs every day to get a better understanding of what are the challenges that are presented to SMEs day to day, whether it be all of your HR concerns or questions, which tends to be the most common thing that sort of comes up with Breathe. But the next thing was health and safety. That did crop up quite frequently. And we wanted to understand what health and safety actually kind of looks like in the SME landscape in 2026. As always, there's always legislation changes going on. Everything's in flux. It's kind of getting a better understanding of what makes you sort of legally compliant. What are you responsible for as a business owner and as a leader of an SME? So part of that, with us needing to get to know sort of the landscape, we ran multiple surveys with managers and leaders of businesses from sort of under 250 employees. But also we ran surveys with the employees themselves, similar sized businesses, to hear their sort of first-hand experiences, because it can be very different being a business owner or a leader within an SME and being an employee with SME. Health and safety can mean very different things to different people within a different organization. So in today's session, sort of based off of those surveys that we've conducted, we're going to be going through the most common health and safety risks that have cropped up, and how we go about solving them. So we'll be talking to Cy and Emma and delve deeper into that information that we've got out of those surveys, and of course compare those to the poll results that you've all been clicking away at, and trying getting a better understanding of that health and safety landscape in SMEs to make sure that you're fully armed and capable to handle all your health and safety needs. So I think we should crack on with hidden risk number one, which is gaps in documentation and processes. So we can see some key stats here that have come out. So 45% of business owners had one or more health and safety documents that are out of date. 48% hadn't done a health and safety audit in the last 12 months or weren't sure if they'd done one in the last 12 months. And then you've got 42% said some health and safety tasks fall behind. So you can see that's almost like a 50-50 split as to whether this documentation or processes are up to date. It's kind of a flip of a coin, right? And I wonder if we could take a look at the poll results to see any sort of commonalities there. So we can see sort of hardest things to stay on top on is reviewing, is risk assessments. Am I seeing the full one? I'm not seeing the full one, but risk assessments is indeed the top one there. But also we've got sort of reviewing and updating your health and safety policies, regular inspections, training and records. So there's quite a even split, but risk assessments is definitely the front runner there, closely followed by updating health and safety policies. Emma, what do you think about one, the results that we've had from the initial survey that we've run, and then the results from this poll as well?
I think it's not unsurprising, really. I think as business owners and leaders in the SME sectors, I think you already mentioned Si wearing many hats, and I think that's the case for many people who run small businesses. And health and safety is not going to be their area of expertise, and it might also be that it falls between two stools. You know, like it might have started off as one person's job, and then it was passed on to somebody else. Or you might have got somebody in to do it, or you might have used the HSE templates, or maybe taken templates from somebody else, and you might have, with all the best will in the world, put the documentation in place, and then things might have changed in the organisation. For example, you might have got some new machinery, or there are new systems, new practices, new staff, and all of this, in a busy business that's growing, all of these, can fall off the radar. So we see it all the time, and I'm unsurprised by the results of the poll.
Yeah, and around that as well, so what are the key sort of risks about these processes and documents sort of falling behind? And not to kind of like scaremonger people, but what are those? No. What are the potential risks around that?
So I think the risks are that the documents aren't fit for purpose. So they might be out of date. They might be wrong for the business. You have to really think about sector specific and what are the real risks. So, what are the real risks? Is it relevant and appropriate for the risks? Have risk assessments been undertaken properly? I think risk assessments are really the cornerstone for health and safety documentation. Really important, and important for very low risk businesses. So I would class a low risk business as something like an office, and even and obviously increasingly more important for a higher risk construction sector, factory, manufacturing. So a higher risk environment. I'm obviously doing this webinar from home, and we're seeing many more people remote working, home working, hybrid working. Have you done risk assessments? Has the organisation done risk assessments for the home environment? Because actually, case law is telling us, that home environment is also the workplace as well. So really important that you put the documentation in place, but also have the right person with the requisite knowledge and experience and expertise to do the documentation, make sure it's relevant, and keeping it up to date where there have been changes, like working from home.
Yeah, I think the other key thing there. Oh, sorry, Dan. One of the key things there is I think mentioning there about the risk, low risk, high risk. One of the things that I found here and in my previous careers is when you've got an office-based scenario where it is deemed as low risk, you can't let that stop you from just continually driving for a really good health and safety package within the organisation. You can't let people get lapsed because you are deemed as low risk. It's almost more important to keep on top of it because there is that risk there that people could start to think it's fine. We're low risk, desks, chairs, screens, that's all we have. Slips, trips and falls will still happen in exactly the same way in any other places. The boxes in the wrong place, your fire safety standards, everything has to be just on top. Everyone has to be on top of their game, and you have to be on top of your record keeping. So I think it's really key to understand that no matter the level that you're assessed at, health and safety is as important across the board for that.
And that leads on perfectly to my next question. So it's like within an SME, when you're wearing sort of many hats, and this is a kind of a question to both of you, what's the potential sort of risks in terms of value if health and safety is not doing well? Is there any impact on ROI for an SME if they're not keeping health and safety as kind of like a top priority?
Well, I think, look, it's a mandatory requirement. And if you don't do it, the potential penalties are significant. And I think for health and safety compared to HR, for example, like health and safety is enforced by the HSE. So there's an external agency enforcing accidents in the workplace. The owners of the business are ultimately culpable, and there are fines. You could be incarcerated for breaches of health and safety regulation, right? In the most serious, most serious cases. So return on investment, difficult. I think there's a fear factor in health and safety as well. So I just talked about the fear factor. The benefits of getting it right are safer working place. Culture of an organization where the people, because it's ultimately about people, isn't it? And the safety of people. And that's both the physical safety and psychological safety and well-being of people. So you can create a wonderful workplace if the people feel like their safety is being taken seriously, and that has a knock-on effect on ROI that goes to rates of retention, lower rates of attrition, and engagement and productivity, and all of that. So it's quite far-reaching. I think the ROI of getting health and safety right is incredibly far-reaching.
Excellent. And sort of bearing all that in mind, Si, would there be any advice sort of within your role that you could give to other people in sort of a similar role, staying on track and on top of all of your health and safety duties? Have you got any advice there?
Yeah, absolutely. And again, no matter where you're based, office based, whether you're construction out on site, health and safety doesn't have to be a terrifying thing. It can actually be quite enjoyable to maintain and run. The more you're involved with it, the more you get your teams and your colleagues, your peers, across the board. If you get them involved, you have an entire team of people that are helping you maintain health and safety. It's not just you or your team doing it. You've got a whole troop of people that will be spotting anything that they think needs to be reported to you. They will highlight, they will get engaged, they will bring these things to you. So you can bring a team together. Here at Breeze, we have a team of 5 or 6 people, not within my department, but we have a team of 5 or 6 people that are regularly in touch with us about health and safety, fire safety. It's a really important factor. So number 1, get your team involved, get the wider business involved. Number 2, documentation. Emma's already mentioned it. It's critical. Make sure your documentation is up to date and find a centralized place that works to maintain it. That is the key thing. I've been in organizations where there was no real funding for a health and safety platform. It was all filing cabinets with paper in it. And the irony being, if there's a fire and your building burns down, you have no proof that you've done anything. So you can't justify what the elements of work you put down before that are. So when you look at it as a bolder sort of bigger picture, the maintenance of your documents, keep on top of them regularly. It will not feel like a chore every month, every quarter, every half year. If your maintenance is there, centralization of documents, and get your team involved, it will become quite an enjoyable experience to manage health and safety. And keeping on top of that legislation is actually quite easy because it's there online for you. Just regular check-ins, use AI as your starting point, and then you're straight in the door with understanding what's coming around the corner.
Love it.
And I think you made some really... Yeah, I was going to say that you made some really important points there that go to the heart of the regulations as well. It's not just one person's responsibility. It's not just, whilst, I talked about the buck stopping with the owner, there is the Regulation 7 requirement of a competent person, but it isn't just the one, like the competent person's responsibility either. It is everybody's. There is an overriding duty of everybody to look after themselves and others as well, to take care. So I think I've yet to see a workplace that gamifies health and safety. Then that could be a challenge, right? But and if anyone is doing that in their workplaces, I'd love to know. But it is about workplace coming together and creating that kind of safe culture. So I think involving all of the teams is really important.
Absolutely.
Love it. Excellent. And this kind of leads on lovely to the next hidden risk, which is ownership without expertise. But one thing I do want to call out is there's a message in the attendee chat that says, we work safe or we don't work at all. That's from Ken. I think that is spot on, bang on the money. I really like that one.
Yeah.
So just wanted to call that one out. But hidden risk number 2, we've kind of already touched on this and we can delve a bit deeper into this now, but that ownership without expertise, whether it's been people not having enough time to do that or there's manual processes. So I kind of, as you mentioned, if people are logging all of their health and safety documentation on physical documentation and, you know, in filing cabinets, if the office burns down, you know, that's a big risk. But in terms of sort of that ownership without expertise or juggling it with another role, especially in your role, you've got multiple hats, right? How do you balance health and safety with your other responsibilities, especially how you kind of vocalized about health and safety being a real top priority? How do you juggle all of that?
I think the key thing there is exactly that line of being a top priority is you get that message out to the business, to your leaders, to your manager, whoever you are within the organization. It needs to go up, down, across the business. It doesn't matter where you sit. So I think getting that fact steadfast straight away is the key thing, because then it becomes a point that no one can question you on how much time you spend doing health and safety. It is such an important fundamental part of what you do. And like I said before, keeping on top of it means that when you are doing your health and safety duties, if you diarize them on a daily, weekly basis, whatever time you commit to it, it's just a small amount of time and it becomes second nature to you. So when you are prioritizing your week, you're looking at all your meetings, your offsites you've got to go to, your client calls, there will always be time to put aside for health and safety, because it's when you don't put that time aside that things will happen, and they will happen fast. So you've got to be able to react to those. Having that preparation time set to one side means you're always on top of it. And again, going back to the point that Emma and I have spoken about is getting your teams involved. If you're out of the organization, you've automatically got a team that are looking after it for you while you're in the business. If you're out of office or you're on holiday, whatever it may be, you've got eyes and ears across the business that are ready and willing to assist you. So prioritizing it shouldn't really be something that you have to actively think about, because it becomes a second nature piece to you. And that's why it's so key to have that core centralized area where you are logging your information, one source of truth, rather than having it sporadically spread across multiple drives and multiple emails from people. And one of the other things to note is, in my time of doing health and safety, which is quite a long time now across my career, I'm yet to meet a health and safety executive that's come out for a visit or an audit, and we've invited them in. They have always been incredibly pleasant people and are willing to assist you, even when they've left the building. They're on the end of on the end of the phone or the email, very, very willing to help. And I think that some of them, bless them, have this this sort of feeling that they are this very straight to the point person that's going to come in and tear your record keeping to pieces. And actually, they'll come in and it's their job. They're passionate about it. They're there to help you. So invite them in, ask them the questions, and that will get you a long way, because you'll identify immediate gaps that you may have.
Yeah, love that, with them kind of being there to help. And I also like the point you mentioned around sort of that shared ownership and that sort of central repository, especially when it comes around to sort of like health and safety policies or insurance, where it requires what sort of legally is phrased as a competent person. I use inverted commas there. I mean, Emma, what does that actually mean when they're sort of saying a competent person? What does the law actually require there?
So as I already mentioned, that's Regulation 7 of the Managing Health and Safety at Work regulations, 1999. I swatted up on my dates, and it's about the right person having the requisite training, requisite knowledge and experience in the role, and that can be an internal person, or you can have an external consultant to be the competent person and carry out that role, and that just means you've got the right person doing the job for you. What really key part of that is training. So you don't need to be a health and safety specialist. There's really no excuse nowadays, for small businesses, because there's so much training available, bite-sized training available for various mandatory courses, and you can train your people in these things. It's really, really important. So that's it's the right person doing it, and doing it competently, as the name suggests.
And that leads on lovely, as you were mentioning, sort of with training, leads on perfectly to the next hidden risk, which is around sort of the training and reporting gaps. So from the surveys that we ran, we can see 50% of employees had never reported a risk or an incident, either because they never thought they'd seen one, or they didn't know whether they could report one. And then also you've got 43% of employees hadn't had any health and safety refresher training since their onboarding. I think a lot of this can also stem around whether it be languages and definitions, sort of what is an incident, what is a risk. And so I was wondering whether you could kind of delve a bit deeper into sort of how it's better to sort of define what is a risk, what is an incident, when do you do a risk assessment, and things like that.
Yeah, absolutely. Thanks, Dan. I think the key thing is, you mentioned it there. We've spoken a few things about the competent person and being everyone's responsibility. Is understanding those definitions, as you mentioned there, Dan. What's a risk? What's an incident? What's an accident? It's the same with looking at a near miss. I liken it to, you're driving down the road. There's a T junction with traffic lights. The traffic lights are out. That is a near miss. An accident could happen. It's a near miss. The next step is you take that responsibility to report it. Don't think to yourself, oh, someone else will report it. It's fine. I'll just carry on driving and hope the next person reports it. If you employ that same mindset at work with something like a near miss, it's spotting something that will has the potential to cause harm, or something that did happen that didn't cause harm, that has to be reported. So understanding the definition there of what is a risk, what is an incident. A risk is something that has the potential to cause harm, as an example. An incident would be something that actually happened. So pre and post, basically. Accident, something that's caused harm, requires someone to go off to seek medical care internally, externally. Really getting those definitions nailed down. And you could do something as simple as having them on a poster on the wall. There are posters available for health and safety in multiple forms, and they're available in multiple retailers, online, in shops. You can be able to get them, pop them up on your wall, get it part. There's a message in here from Kath. Thank you, Kath, saying health and safety is a standing item on our weekly team meeting for staff that shouts out any concerns. In those team meetings you have, even if it's a monthly meeting or a quarterly meeting, reiterate the definitions of health and safety. Your meetings don't just have to be about business performance. You can bring in an operational aspect of it there as well. So key definitions within those, and talking about the refresher training, making sure people are aware that that's coming around the corner, make sure they're aware of what's required from them. And again, people have this fear of the training, thinking there's going to be a test at the end. If I fail, what happens then? The main thing to remember with health and safety is 99% of it is common sense. It is just as simple as common sense. Yes, there's laws, there's regulations, there's a lot of other bits and pieces around it that support it. But the crux of it is common sense from everyone gets you so far with health and safety that going back to the maintenance piece, that becomes a little bit easier. And then making sure you've got your completion records for people when you do have your training. You've got a full catalogue of everyone aware of the definitions of those risks, incidents, accidents. You've got everyone aware of what their training requires of them when they do it. And if you happen to drop the ball on something, again, you've got a team there that will help you pick that ball back up and get you rolling again.
Yeah, I was loving what you were saying, sort of around sort of people kind of taking ownership themselves and it being a responsibility in themselves to kind of keep a lookout for health and safety, not kind of like passing the buck and going, oh, someone else can report that. And it's not to say that health and safety should be at the forefront of everyone's mind every second of every day, but it's having that ability to kind of like recognize it's going, oh, that could potentially be a risk or a near miss or whichever, and being able to go, right, well, I can raise that, know how to raise it, and how that is then managed going forward. But a question to Emma, sort of, what potential reasons do you think there are about why people may not necessarily be reporting risks or incidents and sort of taking ownership of that, maybe sort of more from sort of an employee perspective?
So many potential reasons. I mean, as you were talking, so I was thinking about that really talks about, like, feels like it's about psychological safety. So in that weekly meeting, I feel safe enough to bring up something that might be a criticism of the organization, for example. It might be something I've spotted that, as the organization, we're not doing properly. But I feel safe enough to bring it up and bring it to the attention. So I think that's, why don't people bring the, sort of raise these concerns? They might genuinely not feel safe. They might feel like they might be criticized or ostracized or dismissed, right? So these are, and there are protections around unfair dismissal, around genuine whistleblowing. So we're going into the employment law stuff, but there is a key relationship between health and safety and employment law, and employees are protected if they raise concerns about health and safety problems, and then if they're treated less favourably, so for example dismissed or whatever, for raising those. So they might not feel safe enough. They might not care. They might go like, I'm just here to pick up my wages and go home, and I might not feel engaged enough, and I think those are two pretty serious reasons. You've got a problem in the workplace if that's how your employee is feeling, and it might not be a problem that manifests immediately, but it will. It may well fester and rear its head, at a later stage.
Is there any way you could kind of almost sort of recognise that to then sort of avoid it becoming a bigger thing? Are there any sort of maybe precursors to that you would go, oh, this could crop up?
Such a good question. Well, I think that goes to really good people management, doesn't it? And that goes to the root of like a regular one-to-one, good management, confident management style, and good relationships in the workplace, and making people feel safe. I think it's around doing what you say you're going to do and carrying it out as well, so people Absolutely. Feel safe.
Yeah, and I think that's one of the key things there is being, like you said, your management style, your people style, being approachable. I've got a lady called Hannah on my team. She is fabulous. She helps me day in, day out with the health and safety within the organization, but she is an incredibly approachable person. And I've always said to her, no matter what I'm doing within a week, if there's an issue and it's health and safety related, it's probably more important what I'm doing. So come and interrupt me, come and have a chat to me about it. That goes up and down, that goes across the business as well. So if anyone is spotting something and Hannah and I are both busy, they can come and interrupt either of us. It doesn't matter. And you mentioned something earlier, Emma, that made me think about it, the, not my job scenario that people have. Like, I see a box in the way, I see an uncovered wire or something like that, and I think that's not my job. Someone else pick it up, because I'm not the person that should be responsible for it. It's someone else that needs to be spotting it. It's trying to get rid of that mindset within the organization. So that is something you can spot quite early, is if you spot something and no one else is spotting, you can see something potentially happening and no one else is aware of it. That's a precursor to thinking, right, there's more training that can be done. There's more that needs to be done to make people feel psychologically safe to come and raise anything, and it doesn't matter what it is.
I remember doing an employee satisfaction survey for one of our clients, the 100-person manufacturing business, and we're on the third generation of family ownership as well, and I got a 50% return rate on the employee satisfaction survey. And I was dismayed. So I went in person and interviewed everybody. Why aren't you responding to my survey? Why aren't you telling me what you think? Why aren't you, and the disgruntled, they're all blokes as well, disgruntled, like, well, no one ever changes anything. We say things and nothing ever happens. And, so that level of, that level of disengagement, really damaging. And it permeates through, you have new people coming in and that culture will spread, really difficult to change. But repeatedly, what I was being told was nothing changes. We raise something and nothing is done. They don't listen to us. So it's trying to challenge that and change those cultures to get people to talk about the risks and point them out.
Honestly, I've really enjoyed sort of just talking and listening to you guys about sort of that hidden risk. It's made me reflect on a few things that when I first started out my career, when I was working in television in 2013 and being sort of new to that industry, and that's really made me reflect on a few things. I've gone, hang on, that was actually a health and safety risk, and I didn't necessarily was comfortable enough to come out and speak about that. So I think that's made me have a ponder there. Really like that one.
Well, we
not
can't
that
talk
I should have
about
favourite risks.
You can't talk about television film industry without mentioning like massive risk, and that's like the sexual harassment regulations as well.
Exactly.
And that's just flag that up as such a significant set of regulations, which makes a proactive obligation for employers to undertake risk assessments about potential risks for sexual harassment in the workplace. And really, really important, and highlighting again the relationship between employment law and health and safety. Where employment law is moving closer to moving closer to the health and safety way of working with the risk assessments. And there's a rise of these incidents in the workplace, unfortunately. Being reported. So, very, very significant obligation for employers to take into consideration as well.
Yeah, lots of really valuable insights there on hidden risk number 3. Moving on to hidden risk number 4 now. We've kind of touched on this briefly towards the beginning, and it's the challenges around sort of remote working. You can see, I'm currently sitting at home. And sort of obviously naturally with COVID coming along, remote working and sort of hybrid working has really kind of come to sort of, the forefront of most businesses. So we can see here that 50% of remote and hybrid employees hadn't completed a DSE assessment. I myself have got a nice ergonomic chair. I've got a standing desk. I like to make sure that I'm comfortable whilst I'm working. But also 60% of people had never had an electrical home working equipment tested. Or at least not since it was initially issued. So Emma, sort of what? Again, it's a tricky one because obviously it's it feels like it's outside of sort of the. You could almost argue outside of the organization's responsibility because it's not the shared office space. But what are businesses actually responsible for when it comes to hybrid and remote working?
So it isn't outside the employer's responsibility. Absolutely, runs parallel. And I think that if we think back, almost 6 years to COVID when this really took over. I can't believe it's been 6 years, and where home working became the norm. And we were asked. By our clients to put in, to help them with DSE assessments, and doing all of these things remotely. I think the responsibility of employers around the home working arrangements can be overlooked because home is definitely workplace. So a risk assessment is required. You can do them effectively if you have your workforce spread out around the country. You don't necessarily need to go in person. This is historically how they would have been done, but there are much more cost-effective ways of doing DSE assessments. So you absolutely need to do it. And think about risk assessing employee safety around all sorts of things, because there is some, there's case law about, what is the workplace, what constitutes the workplace, and where the employer's liability starts and ends, and it's much wider than you would think.
Yeah, and I think kind of what you're mentioning around sort of the DSE assessments, I know, say, for example, multiple organisations that I've worked in, we've had separate sort of systems to perform a DSE assessment compared to the HR system that we're using. And then there's a physical accident logbook. So you've got all of these disconnected sort of systems and HR and health and safety silos, which leads us perfectly onto hidden risk number 5, where we are talking about those disconnected systems with HR and health and safety. And 50% of SME managers from our survey reported they're still using spreadsheets, emails, and bits of paper. And actually, spreadsheets and emails, you can argue that they're sort of cloud-based, especially if you're using like a shared spreadsheet, like a Google Sheet or something like that. If you're using bits of paper to manage health and safety, I can imagine that is a massive risk there. I feel we've kind of touched on that briefly, sort of towards the beginning of the webinar. Is there anything, Emma, you want to sort of expand on that sort of risk with those disconnected systems? Well,
I think version control would be one of the version control of a document, the relevance of it. We see we see clients who say, okay, well, all the policies sit on the shelf at this site, but that's a multi-site organization. So, I actually just had this week where they couldn't find the signed version of manual 3 or whatever. They could only find an old version, so it's all of those. Having a cloud-based system, this is where I do a great plug for Breathe. Having a cloud-based system has everything all in one place. You can control the version. You can the versions that are up and available for the employees. So Regulation 10 of the Management Health and Safety at Work regulations requires requires the employer to provide the employee with the policies. So you can tick that box as well by providing clear policies, by providing the training, having it all in one place, and then being able to record who's read and seen it as well. So really, the easiest way to be compliant is a simple way, and having everything in one place, having the risk assessments in one place and the right version control, for example, is much simpler and more likely for everybody to be compliant. I think that's just that's common sense.
Mm-hmm. Yeah, and whilst the poll's still out there, I forgot to mention that we were pushing that poll out about how everyone manages their own sort of HR and health and safety. Si, do you have anything to sort of add to that with sort of your past experiences? I remember speaking to you sort of previously around sort of how you'd managed health and safety audits in your sort of previous role. How do you sort of, what are the challenges with sort of juggling things when they're in multiple different places?
I think the key thing Emma's mentioned there is version control. You use that if you're using multiple systems, make sure your version control is switched on. You've got a shared spreadsheet with 12 people. It just takes a slip of a finger to delete a line or delete a column, and your data's gone. Right. So you've got your version control. Make sure you can roll back to the previous data you had. You've got to make sure, as we've talked about already, the responsibility is there. There's nothing wrong with asking a bit of sense checking. Get someone to double check something with you as well. Don't be afraid to ask that. So if you've got something that you are using across multiple sites, as Emma mentioned there, a book 3 couldn't find the signed copy, is you've got that responsibility to make sure you've got that available for your employees. Make it accessible. Make sure that you've got something that's easily accessible for your employees and for yourself. And then also, if something happens, if the HSE come in, it's accessible for them as well. To be able to get information in and out in an easy manner is one of the key things that I've always asked for in any organisation I've been working with health and safety. Is I want to be able to document something. I want to be able to pull that document and report on it as easily as I put it in, because it's, like I said, things happen and things happen quickly. You need to get information in and out. So If you are juggling across multiple platforms, the first thing I would suggest is to try and minimize that as much as possible, centralize it as much as possible. If you do have multiple bases, multiple requirements for multiple languages, as an example, you've got sites around the world. Understood, you might have a few different platforms you're utilizing, but try as best as you can to get a nice central spot that everyone knows is there and everyone understands what it does as well. That's the key thing, is people, you push an email out, inviting them to a platform, they'll look at it the first time, log in, make sure they can log in, and then forget about it. Again, it's reiterating in those meetings that we have this platform. Here is where you go for your one-stop shop. And as Emma's mentioned there, the policies, if you've got people that are engaged, they will read the policies themselves. It's rare, but they will go off and find the policy. If they see something, some people will use it as a challenge and they'll say, I'm going to go and read the policy first just to make sure I was right in what I'm thinking, confirm they're correct, and then they'll come to you with their point. So that's really important.
Love it. Thank you both. Very sort of insightful stuff there. I think what will be interesting to see now is these poll results come in to see how all of the attendees are sort of managing their health and safety. And we can kind of see you've got your HR and health and safety documents, at least 75% of attendees having that stored separately. It's great, obviously, if you know where those are, but having those in separate locations, if you're trying to access something quickly, it's another system that you've got to access. So yeah, that's a really sort of, that kind of backs up what we were saying around sort of those silos and sort of the risks around those silos. Which is now the perfect chance for me to introduce, drumroll please, coming soon, we've got Bree's new health and safety module. This is something within the R&D team we've been working on for the past couple of months, sort of based off all of that survey information and sort of research and analysis that we've been doing around health and safety in the SME landscape for 2026. We've got some awesome features coming within the new health and safety module to be able to create and review risk assessments. You can record your accidents and incidents. Employees will be able to do that as well. So that encourages sort of that culture of being able to come forward and report something and take the ownership of it. Be able to track your health and safety roles, such as your health and safety officer, fire warden, and so on that we were mentioning, and to track those certifications. Policy management, something we already have within Breathe that we're building upon within the new health and safety module. Assign tasks to follow up, so people have got that one-stop shop to be able to go, right, I need to complete this task for this risk assessment. And like I mentioned, enabling employees to be able to report those incidents, and that will bring all of your HR and your health and safety documents and data into one place. Now that is coming very, very soon. So keep an eye out for that, and we'll share more information at the end of the webinar for that. Cool. So let's move on now to sort of summary and practical sort of next steps. So we've taken a look at those gaps in documentation and processes, that ownership and sort of having that shared ownership. That's the one thing that I really kind of took away from that, is you can have a health and safety officer within an organization, but it is that shared ownership that's really important to make sure that as an organization you kind of remain compliant. And those training and reporting gaps, again, that kind of brought some memories up for me back in my sort of previous experiences where I'm like, hang on, that wasn't quite right. Actually, I should have raised something there, but may not have felt comfortable doing so. And naturally, remote working, as you can see, myself and Emma currently working from home, so repping in the office, love it. And as we've touched on as well, that those disconnects between your HR and health and safety systems, as we saw 75% having health and safety and HR in separate data silos. So what I'd like to ask, question to both of you, and Si, maybe if we start with you, is just if you could give one practical bit of advice for everyone attending this meeting going forward for managing their health and safety, what would that one bit of advice be?
It's difficult to wrap it up into one piece of advice. It's the summary you've given there across the webinar so far, and everyone's experiences. I think the one piece of advice I'd say is take stock of your experiences in health and safety you've had, either in your current role, across your roles, no matter how tenured you are within your organization. Take stock of what you've seen and what you've heard, and make sure that you get that culture right within your organization of health and safety. Make sure that it is there, it's on the tip of everyone's tongues, it's the forefront of what they do. It doesn't have to be the troll that lives under the bridge that everyone is terrified of and doesn't want to go near. it really is something that should be applauded and welcomed with open arms, because it is such an important part. You're not just keeping the business safe, you're not just keeping yourself safe, you're keeping your colleagues safe. I mean, you think about it from that point of view, what happens at work, if there's an effect at work, it will also affect you at home. And I think the most important thing is have that full understanding across the business of it's a team effort. So that's my piece of advice, is make it a team effort.
100% loving that team effort side of things. I think that's the key thing that I've kind of taken away from this. And same question to you, Emma. One bit of practical advice going forward, what would that be?
So people are really important to every organisation, and I think the organisation needs to make people feel like they are valued and important. I think that the simplest way to do this is to not overcomplicate the health and safety and HR piece. Whether you go externally for HR and health and safety and use a consultancy like mine, or whether you have the skills in your internal team, make sure that your documentation and the people in charge of the health and safety and HR piece are the right people, and don't just pay lip service to putting documentation together. I think really, value your people by doing it properly.
Yeah, excellent. Some really, really valuable advice, even just from that section alone, but from the entire webinar there. I've certainly learned a hell of a lot. I hope all the attendees have too. And I think that advice leads beautifully now on to our Q&A, so to give people the chance to ask any further questions, and we can answer a few questions live. Whilst we get some of those questions together and start going through those, there's also just a survey just on how you found this webinar. It's really valuable for us going forward to understand how much you got out of these webinars, so we can make these better and better as we go forward. So if you have a couple of seconds just to go through that survey, that would be great. Cool. So first question, how long does a health and safety document stay sort of within date? How often do you have to kind of like review that document, or does it vary from document to document, policy to policy? I'll put that one to both of you.
That's a how long is a piece of string question. And I'll answer it like a politician. And I think you've given me part of the answer. And I think it varies from policy to policy. So if the law has changed, then that's going to trigger a requirement to review your documentation. If something at work has changed, machinery or a system of working, that's going to trigger a change. I think the rule of thumb is an annual review. I think that would be the sort of standard. But in a more dangerous, or in an environment that is recognised as more dangerous, you would undertake more regular checks. So site inspections would include checking the documentation as well. So I think hopefully I've dealt with sort of a comprehensive politician response on that.
And is that the same for sort of risk assessments? How often would like a risk assessment require review, or again, does that depend on location, organisation, etc.? So again, sort of how long's a piece of string kind of thing?
I think that depends on the nature of the system. So if there's a change in something you're doing, for example, if you are undertaking there's a new system of work or a new piece of machinery, for example, it's important to keep the risk register up to date. So they're clearly allocated responsibility to the manager, for example, of a site, to undertake the risk register or the equipment, the register, and to make sure that that new piece of equipment is there's a proper risk assessment on a new piece of equipment, because that could lead to that flags up a potential risk.
Yeah, I think change is the important part there, isn't it, Emma? It's when something has changed. Take two drastically different scenarios, a whole new piece of machinery at work. You may be replacing like for like, but your old machinery was 10 years old, brand new ones come in. There may be some newer safety features that have been installed on a newer device than there was on an old one. So it's changed. Don't just assume because it's the same machine, you need to treat it in the same way. And then the other end of the spectrum, you're at home, you've got yourself a new chair. Okay, it's a chair. You sat on the old one yesterday, you sat on your new one today. Fundamentally, it's a chair, but they are different. All right, it's things like that. So something has changed that should trigger in your mind as an employee and as the person responsible for health and safety. Again, someone should feel comfortable enough to report and say, hey, got a new chair, got a new desk, whatever it might be. Do I need to reassess myself for DSE assessment, as an example? So I think that's the pivotal thing. The real critical thing is that word change. Something has changed. Let's look into it.
Mm-hmm. And on the risk assessment side of things as well, this kind of leads on to the next question is, so we've got a question here about being a tenant in a larger building. Where kind of does almost like the jurisdiction of a risk assessment end? Should you be doing the risk assessment for the office that they're currently renting, or should you be doing it for the wider premise as well? So it's building with multiple offices in. Where does sort of the health and safety boundaries kind of lie with that when it comes to a risk assessment?
Emma, do you want to take that one, or do you want me to go?
So do you want to sort of say that again?
So it's you've got a tenant in a larger office building, right? And there's multiple offices within this building. Are they responsible for just doing a risk assessment within their office that they rent, or are they responsible for doing a risk assessment for the wider premises as well?
No, so there'll be different responsibilities. So there'll be tenancy responsibilities and there'll be landlord responsibilities, and those should be reflected in. They'll be reflected in, whatever commercial agreements that there are in place. Typically, the landlord has like overarching obligations, and then will discharge those obligations to the tenants. But the tenants are, let's say, you have different businesses or different organizations running different things. The tenant, in your business, the tenant will want to do their own risk assessments for whatever happens, whatever's going on in their business.
Yeah, absolutely. And Dan, think about us, where we are, 2 offices, one across the road from each other, different landlords because they're just on different sides of the road, but they both have quite a different approach to the health and safety aspects of it. So when it comes to the reviews, yes, they're all done, but one of them is a lot more collaborative and informative. The other one is quite radio silent, but we know they're being done, and they will send them to us. But the other one will reach out 2-3 months beforehand. Hey, we're doing this. Going to come and do a site visit, etc., etc. So knowing who's responsible for what is the key thing there. If you're in a shared office space, as an example, not just renting a floor or an office room, if you were just hot desking an office as well, collaborating with the owners of that building is really important as well there. And they should be very open to a conversation about health and safety, sharing documents that they've got that are in a format that can be shared widely. You say, I'm doing my own assessments. Can I see what you've got for the entire building? If they're hiding something from you, that should raise a red flag to you. So collaboration across with your landlords, the site, and people around you, again, that should not be a barrier.
Okay, thank you very much. Conscious of time, because I'd like to get another question or two in, but just to clarify, we will put together sort of like an FAQs of this webinar as well, and put some of those answers together so we can share those out, because unfortunately I'd love if we had time to go through all of these questions, but we'd be here quite a while. So the next one I want to touch on is around sort of fire safety. So this particular question is around, do all staff need fire safety training from a licensed professional, or is training from a fire warden sufficient in an office space? Where's sort of the boundaries on that one?
So I think a standard way of delivering and disseminating training could be toolbox talks. So if the fire warden has requisite training, knowledge and experience to disseminate some toolbox talk type training, that's fine. But there's no excuse really why all employees, in my opinion, don't have some online training for this sort of thing. It's really easy and accessible. I think gone are the days when people are expected to go out on site, and there are different levels of of fire training as well. I think there's awareness, and the same with first aid. There's awareness training. There's actually hands-on training, which will require fun stuff like how do you use a fire extinguisher, and you can people you get to light fires and then have a go at actually extinguishing them. But I think there's a level of awareness that can be delivered via an online course or toolbox talk.
And just touching on that, Emma, with the fire training, thinking about your fire wardens, one of the important things to do is think about scheduling as well. If you look at the requirements and it tells you need, as an example, 1 fire warden per 50 people, you've got to think about the amount of people in your organisation, but also think about what happens if you are hybrid working. The 2 of your fire wardens are off. We at Breathe historically double up on what we actually need. So we look at the requirements. If we need 2, we'll get 4. From a health and safety point of view, from a first aid point of view, exactly the same thing. We always go overkill with what we need rather than sticking to the bare minimum. Holiday cover, sickness, and hybrid working, you've got to factor that in rather than just looking at it as a number that you've been told you need to stick to. Think about all scenarios around it as well.
Excellent. Thank you very much, both. I wish we had time to go through a few more questions, but thank you for answering those ones. And as I mentioned, we will put together a little sort of FAQs after this webinar and share those out with some of the questions that have come up. But yeah, that takes us to the end of our health and safety webinar hosted by Breathe and Effective HRM. I want to thank you all very much for joining. I hope you've all taken a lot away from this. One thing that I want to make sure as well is that if you have noticed any risks or gaps within your organization, that's fine. You've done the right thing. You've come to a webinar, you've taken the chance to educate yourself more around health and safety to call out those risks, and it's bringing health and safety to the forefront within your organization. And hopefully now you're feeling sort of more confident as to how to move forward, how you can put certain things in place to make sure that you are protecting not only yourself and your business, but also all of your employees' well-being as well when it comes to health and safety. Big thank you, Emma and Si, for joining. Like I said, I've learned so much in an hour. Really enjoyed sort of hearing your experiences and getting you sort of your advice and your expertise around health and safety. Just to mention as well that this session has been recorded, so if you want to come back and take a look and go through a few bits if there's things you needed to clarify, this session is available to view at your pleasure. And also as well, just to call out to the new Breathe Health and Safety module, which will get more information on our website, and there'll also be another webinar which will give sort of more in-depth tour of the module with link to resources as well. So yeah, just to one thing to call out as well, reach out to Emma for any sort of expert HR and health and safety support. She'll be more than happy to offer any advice as well. And check out the new Breathe Health and Safety module as well. So that takes us to time, everyone. Thank you very much for joining us. I hope you found this session useful. And we look forward to seeing you in a future webinar. Thanks, everyone. Have a good day.
Take care.
Thank you for having me. Bye.